All right. How are our drugs given? So, how do they come to us? What form do we get them in? So, we have our solid drugs. So, they are in tablets, they're in capsules, gel caps. We may have them sublingual that we give underneath the tongue, or they're absorbed. Pills, of course, we're going to swallow and let our digestive system take care of. And then you have your suppositories. So they give them rectally, and then it's absorbed into the body that way, the rectal mucosa. And it doesn't have to go far in. Little KY jelly inserted into the rectum, and it'll absorb right in there. Probably the biggest one that we use is Tylenol. So little patient that is unresponsive and they can't take anything by mouth, go ahead and give it to them by rectum. Liquid drugs, so that solution is a liquid mixture of one or more substances that cannot be separated by filtering or allowing the mixture to stand. The solutions can be given by almost any route. When given by mouth, solutions may be absorbed from the stomach rather quickly because the medication is already dissolved. Solutions that irritate the stomach may be applied topically to the skin, sprayed sublingually, or inhaled. Many substances do not dissolve well in liquids. Some of these can be ground into fine particles and even distributed throughout a liquid by shaking or stirring. This type of mixture is called a suspension. An example of suspension is your activated charcoal, which you may give to patients who have taken overdoses of certain medications or ingestion of certain poisons. There are several other liquid drugs that you may encounter occasionally that include alcohol in their preparation. Tinctures are liquid preparations that are alcohol-based. The name of the material contained in the tincture other than alcohol is added to the name of the tincture, such as tincture of iodine. Spirits are also alcohol solutions that are volatile. Elixirs constitute one of the most common type of medicinal preparations taken orally in liquid form and are made up of a sweetened, aromatic, hydroalcoholic liquid. Syrups are mixtures with a higher sugar content that are designed to disguise the taste of the medicine. These are most commonly used for children's medications. An emulsion is a mixture of two liquids that are not mutually soluble. Emulsions are generally a mixture of water and oil that must be thoroughly shaken to mix. Then we have our meter-dosed inhalers, that miniature spray canister used to direct such substances through the mouth and into the lungs. Our meter-dosed inhalers delivers that same amount of medication each time it's used. Most of the time we're going to see it with our asthma emphysema patients, and they keep it with them. Our topical medications, so our lotions, creams, and ointments, they're applied to the surface of the skin and affect only that area. Of the three, lotions contain the largest amount of water and are absorbed the quickest. Calamine lotion is an example of the medical lotion. Creams, in turn, are absorbed more slowly than lotions, but faster than ointments. Hydrocortisone cream, used to diminish skin itching, is an example of a medical cream. Ointments contain the smallest amount of water, resulting in a smaller rate of absorption of the medication. Neosporin first aid ointment is an example of that medical ointment. Your transcutaneous medications or transdermal medications are designed to be absorbed through the skin or transcutaneously. These medications can affect other areas of the body, so like a nitroglycerin for a patient with chest pain or fentanyl for a pain management are examples of transdermal through a patch. Usually you'll find them here. If you're looking for them though, you may have to get your patient trauma naked. We found one lady had ended up overdosing, and she put like 6 or 8 on her butt. And it wasn't until we stripped her down that we found them. And once we started peeling them off, then we got our respiratory rate back up a little better. So, but don't be afraid to look. Those patches can be anywhere. One of the medics actually ended up, the patient had tried to eat a patch, and it was in the airway. So they had to go in with the McGills and get the fentanyl patch out of the airway. Then we have our gels. A gel is that semi-liquid substance that is administered orally through capsules or plastic tubes. Oral glucose is probably our biggest one that we see. And then we have our gases. So gaseous medications are neither solid nor liquid and often delivered in an operating room. Probably our biggest one that we think of is our oxygen. But you may also have nitrous oxide is another medication that comes in gaseous form and has been used in the pre-hospital environment. It is an analgesic that may be administered by AMTs to reduce pain. Nitrous oxide is administered simply by inhalation through a mask and has both analgesic and euphoric effects. Most systems don't give this to us because they know we'll use it more so than for our patients, unfortunately. So, with those gases, don't forget, oxygen is a drug. So, it's just in that gas format.